How does duty to warn affect telehealth mental health calls? Have you ever wondered how mental health professionals handle serious threats during telehealth sessions? The concept of duty to warn plays a key role in this situation. This legal obligation requires therapists to break confidentiality if a client poses a serious and immediate threat to someone else. During telehealth mental health calls, therapists must carefully assess any statements or behaviors that indicate a risk of harm. If a client expresses intentions to harm another person, the therapist must take action. This could mean warning the potential victim or notifying law enforcement. Even though this breaches the usual confidentiality of the session, it is essential for safety. The therapist's responsibility is to ensure that everyone involved is protected. In a telehealth setting, the duty to warn functions similarly to in-person care, but there are unique challenges. Since the therapist and client are not in the same physical space, the therapist needs to quickly determine the client's location and identify the potential victim. This may involve contacting local authorities or reaching out to the intended victim if they can be identified. During a telehealth call, providers often follow a structured risk assessment process. This helps them evaluate the seriousness of the threat and decide on the necessary steps. For young people using tele-mental health services, understanding this duty is important. It balances the need for confidentiality with the need for safety. If a young person shares thoughts of harming themselves or others, the therapist may need to share information to prevent harm. This can be concerning, but it is designed to protect everyone involved. Therapists typically communicate these limits to confidentiality at the beginning of therapy, so clients know what to expect. When the duty to warn applies, therapists take practical steps. They conduct a thorough risk assessment during the call. They also consult legal and compliance guidelines to ensure that privacy laws are followed while sharing necessary information. If the client is a minor and a threat is identified, therapists may attempt to notify parents or guardians. Additionally, they may contact local law enforcement or emergency services in the client's area. If the potential victim can be identified, the therapist may also warn them safely. These actions are taken to protect the client, the potential victim, and the community while respecting the therapeutic relationship as much as possible. For young people navigating telehealth, knowing about the duty to warn helps set realistic expectations about confidentiality and safety in virtual mental health care. It also highlights the importance of honest communication with therapists to receive the best support while understanding the limits of privacy in crisis situations.